My name is Bon Bennett. I'm taking a public speaking course. This is my final speech of the course. This is a persuasive speech. I'm going to talk about getting people just to think about the effects of smoking that seem to be not talked about a lot. So most people seem to forget about all the effects on smoking in the world around us. There's research that shows like the billions in healthcare costs, all the illnesses and deaths, and even with all the research, all of it just seems to become background noise. No one really thinks about it anymore. We do know more about the effects of smoking than ever before, but there's still millions of people who smoke around the world. A lot of people who defend it will use arguments such as it's only hurting themselves, or they'll talk about the tax revenue that tobacco brings in. Now we're going to look at those issues, and on top of talking about that, we're going to talk about some of the regulations and laws around tobacco use, and some that may come into effect in the future that could benefit us more. I think we should move towards a world where smoking is more like a rare vice as opposed to something everybody does all the time. So if we look at the cost of tobacco on the healthcare system, according to the American Journal of Preventive Medicine, nearly 10% of all healthcare spending is on tobacco-caused illnesses. In the U.S. alone, we spend about $170 billion a year treating these illnesses, and about 60% of that is paid for by government-funded healthcare. So as far as the argument about how much money cigarette taxes bring in, if you look at the book, The Tax Burden of Tobacco, it says that about 7 years, it would take about 7 years of tobacco taxes to equal 1 year of what we spend in healthcare. On top of the financial burden, there's also a lot of health risk. We know the health consequences of smoking and other types of tobacco can be devastating. But we're going to look at the studies done by the CDC that were released in November of 2017. And they show that about 6 million deaths occur worldwide that are linked to smoking, and around 480,000 per year in the U.S. The worst part of that is about 41,000 deaths per year are related to secondhand smoke. So as far as the argument about smoking only hurting those who do it, the studies on secondhand smoke have shown that to be false. I think about it in relation to the argument for abortion. A lot of people say abortion should be illegal because the human life inside the body doesn't have a say in it. And it's the same thing with secondhand smoke. Aside from death alone, it's estimated that for every death, there's about 30 people suffering from illnesses linked to smoking. These illnesses include increased risk of cancer, heart disease, stroke, lung disease, COPD, and all the illnesses that go along with that, tuberculosis, eye disease, rheumatoid arthritis, and immune deficiencies. So we've talked about some of the health issues and the cost on the healthcare system. What can we do about it? There's no clear way to fix this problem. It wouldn't be realistic or constitutional to completely ban smoking, but the current methods are falling short. I think people should actively talk about the issue so it's not just background noise. They should share things on social media, put pressure on representatives to at least address the issue. Some of the things they could push for would be reducing nicotine, the addictive drug in cigarettes, and putting more strict regulations on the manufacturing of tobacco. Currently, there's no governing body that watches tobacco manufacturers. They could be adding, obviously they're adding all types of chemicals in, and we don't really know what all they are. The other part that, aside from nicotine, the other part that leads a lot of people to continue smoking is just the method of delivery, the habit of having a cigarette in your hand. I think if we took more time to promote and even help fund other outlets that reduce stress or give people other ways to spend their free time in a positive way, that could help that part of the smoking addiction. For example, I'd say a tiny percentage of the money we could save on healthcare could give people access to places to exercise, or artistic outlets, or nature-friendly places to spend your free time, and other healthy outlets that should all be easier for people to access. Uh, I also think implementing a indoor smoking ban nationwide could help. We've seen the studies on secondhand smoke. There's no other instance that we have where it's okay to put a dangerous chemical into the air other than smoking. So I don't see why we treat it differently. I also think that if you're smoking in an area, like an enclosed area with children, that should be somewhat related to child abuse. Like I said, the instance of the child being aborted when they have no say in it, or if a kid were being forced to work or in a factory around chemicals, that's all illegal. So I don't understand why it's okay to put something into the air that children breathe in without their say in it. And if you look at a study by Washington.edu, they also say that children of smokers are twice as likely to smoke themselves. So if we made it illegal for the parents or older people to smoke in rooms with children, that could reduce the number of future smokers. So we know the excessive use of tobacco products in our country has really affected our society. I think awareness about the issues and more strict laws are necessary. Some may say implementing indoor bans or calling smoking around children child abuse are extreme, but I think extreme problems need extreme solutions. I challenge everyone to at least spend a little bit of time thinking about the effects of tobacco and maybe consider their own remedies to tell other people in the future when they are talking about it.
Yeah.